Hello, everyone. So, for today's lecture, we will focus on depression. In a world that often prioritizes physical health, we must recognize the profound impact that mental health, specifically depression, has on individuals, families, and societies. It is a silent battle fought by countless people, often in the shadows, and it's time that we shine a light on this complex and pervasive condition. So, over the next few moments, we will explore what depression is, its causes, signs and symptoms, and how to seek for help. So, these are the contents of this presentation. And in the next slide, I would like to show you a short clip from a TED Education video that shows a really good overview of depression.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression's symptoms are intangible, it's hard to know who might look fine but is actually struggling.
All right, so what are the different types of depression? There are two common forms of depression. The main one, it's called major depression, and that includes symptoms of depression most of the time for at least 2 weeks, and that typically interfere with one's ability to work, sleep, study, and eat. There's also something called a persistent depressive disorder, and that often includes less severe symptoms of depression. However, it lasts much longer, typically for at least 2 years. And there are other forms of depression, and that includes a perinatal depression. So that occurs when a woman experiences major depression during pregnancy or after delivery, and that's also called postpartum depression. There is also a seasonal affective disorder, and that comes and goes with seasons. They typically start in the late fall and early winter, so during the colder months, and they go away during the spring and the summer months. So, as mentioned in the TED Ed video earlier, research suggests that genetic, biological, environmental, and psychological factors play a role in depression. And people who have a family history of depression are more likely to experience a disorder. But just because your parents or your siblings had depression, it doesn't necessarily mean that you will. However, your chances are greater. Common symptoms of depression include a persistent sad, anxious, or an empty mood, feelings of hopelessness or pessimism, feeling of being irritable or frustrated or restlessness, feelings of guilt or worthlessness, a loss of interest and pleasure in hobbies or activities, especially the ones that you used to enjoy. Also, having low energy, fatigue, or just being slowed down, difficulty in concentrating or making decisions, difficulty sleeping or oversleeping, also changes in appetite or unplanned weight changes, also aches or pains or digestive problems without a clear physical cause, and suicide attempts or thoughts of death or suicide. So, to be diagnosed with depression, a person must have 5 depression symptoms every day, nearly all day, for at least 2 weeks. One of the symptoms must be a depressed mood or a loss of interest and pleasure in almost all activities. So, during your visit to your provider, they may ask you when your symptoms started, how long they last, how often do they occur, and if they keep you from going out or doing your usual activities. Also, certain medications and some medical conditions, like a viral illness or a thyroid disorder, they can actually cause the same depression symptoms. So, your doctor or your provider can rule out those possibilities by doing a physical exam, obviously, your interview, and some other lab tests. So, is depression treated? Treatment for depression usually involves psychotherapy or medication. Either can work on its own, but a combination of both antidepressant medications and psychotherapy has been found to be the most effective. In milder cases of depression, treatment might begin with psychotherapy alone, and medication can be added if the person continues to experience symptoms. On the other side, for moderate to severe depression, many mental health professionals they recommend a combination of medication and therapy at the start of treatment. So, antidepressants are medications that are commonly used to treat depression. They, however, take time to work. It doesn't work right away. It usually takes about 4 to 6 to maybe 8 weeks, and symptoms like problems with sleeping, appetite, or concentration, they usually improve first before your mood gets better. So it's very important to give the medication a chance before deciding whether or not it works. And there are several classes of antidepressants. And within each class, there are many individual medications. So while all antidepressants they work well overall, there is no drug or type of drug that works equally well for everyone who takes it. Examples of commonly prescribed antidepressant medications are Prozac, Lexapro, Zoloft, and Effexor. It is also important to note that antidepressants can have side effects, but the side effects can lessen over time. Common examples are nausea, drowsiness, a loss of appetite, and sexual problems. You need to talk to your provider about any of the side effects that you have. And also, very important is that you do not stop taking the medications without consulting with your healthcare provider. If you abruptly stop taking your medicine, you can experience withdrawal symptoms. Another treatment is called psychotherapy. This is also known as talk therapy or counseling, and this offers a safe and supportive environment for people to explore their thoughts, emotions, and behaviors. This treatment modality emphasizes the power of conversation and self discovery to help people effectively manage their depression. improve their quality of life, and work towards long term mental well being. A strong and trusting relationship between the therapist and the person is essential for effective psychotherapy. The therapist then creates a safe and non judgmental and supportive environment where the individual feels comfortable sharing their thoughts and feelings. It is also important to note that the choice of psychotherapy type may vary from person to person, and the effectiveness of the therapy often depends on the individual's commitment and active participation in the process. So, these self-care practices that you see on the screen, they can be used in addition to medications and psychotherapy. One of them is regular exercise. Remember that physical activity, they help release endorphins and that can help improve your mood. So you would aim for about 30 minutes of exercise for most days of the week. Also, having a balanced diet, eating nutritious diet, rich in fruits, vegetables, whole grains, some lean protein, and omega-3 fatty acids. Remember that proper nutrition can have a positive effect on mental health. Also, you want to prioritize getting about 7 to 9 hours of quality sleep per night because poor sleep can exacerbate symptoms of depression. And then try to practice relaxation techniques like mindfulness, meditation, some yoga and deep breathing, and they can help manage some stress and anxiety. Also, try to limit alcohol and substance use. Remember that alcohol is a depressant. Alcohol and substance abuse can worsen depression. Also, you want to try to maintain social connections with friends and loved ones. Isolation can worsen depression, so try to engage in social activities even when you don't feel like it. And try to set some realistic goals. Breaking tasks into smaller, more manageable steps can probably help. Achieving even the small goals can help boost your self esteem and motivation. And also try to identify and reduce sources of stress in your life when possible. And there are several resources that you can turn to and ask for help. Aside from your primary care physician, there are federal and local resources that are available. So, on the federal level, we have the Substance Abuse and Mental Health Services Administration. This is a branch of the U.S. Department of Health and Human Services. And then we also have nonprofit organizations like the National Alliance of Mental Illness and the Mental Health America, and that offers free and anonymous mental health screenings. The Substance Abuse and Mental Health Services Administration, they provide the Behavioral Health Treatment Services Locator. The website, you're just going to type findtreatment.gov for government. It is a confidential and anonymous resource for persons seeking treatment for mental and substance use disorders in the United States. When you go on the website, the screen looks like what you see here on this slide. And you can find a treatment facility by just putting in your address, your city or your zip code on the search bar, like what you see on the bottom part of the slide deck. So I just want to highlight this photo from the National Institute of Mental Health. And basically, if you or know anyone in crisis, you can text the number 988. Remember that number because it's a suicide and crisis lifeline, just like dialing 911. Again, the crisis number is 988. I also added this photo on the bottom page of your handout for reference. And that is the end of this presentation. These are the references. And thank you so much for listening. If you have any questions, please don't hesitate to approach me or any member of the staff in cardiac rehab. Once again, thank you and have a good day.